insurance.
The need is great. There's no question about that. Deal with some of the Republican pushback on these points. One, straight politics. They campaigned on repealing. That's the promise. That's what people wanted. They say that's why they have to do it. That there's a lot of waste, that they're not cutting anything completely. The Health and Human Services Secretary says no one's going to lose care. Premiums are going to come down overall for people. There might be less money in the system, but there's still going to be plenty there if states are smarter about how they use it.
Well, the Secretary of Health and Human Services came in front of our committee and said those things, and nobody really believed him. He's the same former congressman that bought and sold health care stocks while working on legislation on those issues. He's the same congressman, more importantly, wants to raise the Medicare eligibility age to 67. I mean, he's never been on the side of working families that care about health insurance. He's wrong there. He wasn't really telling the truth, period.
But what about the spiking premiums that you have, the too high deductibles in places, the insurers dropping out, all under the ACA, and the need to fix those that is driving the Republican change?
Well, look, Chris, you know this. Look what happened at the beginning of the year when President Trump did everything he could to discourage new people from signing up for Medicaid. And those new people overwhelmingly would be the youngest, healthiest people. And those are the ones you want in the insurance pool because they stabilize prices and help to, in some cases, bring prices down because their health care costs are not very much. And then he's continued to sort of dilly-dally every month, making a decision, do we go ahead with the subsidies? Look at the insurers that pull out. When Anthem pulled out of Ohio, they pretty much said it's because of the uncertainty created by the Trump administration. It's not fundamentally the Affordable Care Act. We know what to do to stabilize these insurance pools and to bring more young, healthy people in and to go after prescription drug prices driving much of the medical inflation.
But you had
this
problems
Congress
before,
simply won't do those things.
You had problems before Trump started messaging and sending out signals about the system.
Well, there were problems before, but unlike 50 years ago when Congress passed Medicare, Congress immediately, when they saw minor problems, they began to fix them. This Congress, ever since the bill passed, the Republican leadership in the House, the majority since 2011, every few weeks they do another repeal Obamacare, but refuse to work with us to come up with small fixes that would make this work better. Nobody claims it's perfect. Every time Congress, since the New Deal, anytime Congress has done anything major like Medicaid or Medicare or Social Security, we made fixes every couple, 3, 5 years, minor fixes to keep those programs in place. And that's the opposite of what this crowd in running the country has done now. And a whole lot of people are paying for it. But fundamentally, again, they are taking away the most important tool to combat opioid addiction. And you know, it's all, as you know, Chris, it's all about a tax cut. The average, there's going to be an $800 billion tax cut in this bill, goes overwhelmingly to the people who wrote the bill in Mitch McConnell's office, the drug companies, or the insurance companies, the medical device companies, and the richest families in America. The richest 400 families in America under this bill will get a $7 million average tax cut. And they're taking insurance from moderate income people who are working full-time in so many cases, but simply don't have insurance. It's a bunch of members of Congress who get private insurance themselves, get insurance themselves, paid by taxpayers, taking it away from